Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare.
Welcome back to Sex on the Floor. I'm Dr. Katie Schubert, and I'm here with Dr. Molly Hart.
Yes.
And we are talking about, so in the first segment of this podcast, we were talking about some of the pelvic floor issues that we see in our male clients. Today, we're going to be talking about some treatment options as they relate to those pelvic floor issues. So just a very short recap. In the last session, we were talking about specifically pelvic floor issues that are related to erectile dysfunction, premature ejaculation. Molly talked about some chronic pain issues that men have when they're having intercourse. So to start off, Molly, do you want to talk about some of the treatment options that you use with men who come in presenting with those issues?
Yeah, absolutely. So we talked about this last week. I know from a pelvic floor physical therapy standpoint, things that males are coming to see pelvic floor PT for is erectile dysfunction. Very often, stress incontinence is another one where they're leaking urine, but those you'll see go hand in hand, not all the time, but they can go hand in hand. And then the other aspect that we see is more of a persistent pain. So having pain in the testicles, having pain and or swelling, and then also having pain in the shaft of the penis, the tip of the penis. And then sometimes it can be in the perineal tissue. So between the testicles and the rectum is where men will typically report that they're having these discomfort. And intercourse, more specifically, will typically irritate this. And a lot of times men don't have necessarily pain when they're having intercourse, but it's an afterwards effect that we see. And really that's more so just the stress and strain we're putting on the tissues that comes with masturbation and intercourse. That's my perspective on it more than anything. So let's talk about erectile dysfunction, premature ejaculation, and stress incontinence, those types of things. When males come to see me, sometimes there is a surgical reason why this has happened, such as the prostate was removed and so forth. And so that's very common. When I was working in the insurance-based world, where I was getting a lot of referrals from urologists, I was treating a lot of urinary incontinence and erectile dysfunction post-prostatectomy. So that's because when they remove the prostate, or if they are even just doing any type of operation, there's lots of different procedures they'll do for prostate cancer or an enlarged prostate. When they do that, they can affect the sphincter, more specifically the internal sphincter of the bladder. And so that can lead to the stress incontinence. And then it also can affect certain nerves that are going to affect erection function. So immediately afterwards, we see that a lot of times men are not able to get an erection. They're not able to hold their urine, so they're wearing Depends. It's really sad. It affects males so much. What we'll see is that stress incontinence will typically come first, more often than not. As long as men do a proper strength training program, we absolutely will see that they can gain continence again. So if you're a male out there and you are dealing with urine leakage at all, whether it was from surgery or not, seriously, if you just do strength training program with a pelvic floor PT, meaning we're going to be doing a lot of Kegels, a lot of pelvic floor exercises, a lot of hip strengthening exercises, I have seen all of my males gain complete continence back. I haven't seen one person I've ever treated not gain good control over that again. The only way that I could see that ever happening is if there was like serious nerve damage that happened during the surgery. Secondarily, the erection function, that sometimes can take a year to come back after these surgeries. So that's something I'm considering as a pelvic floor PT is are we getting somebody, post a surgery, or is a male just having erectile dysfunction in general? Sometimes I get, like now currently with my practice now, I get a lot of males coming to me with erectile dysfunction that has nothing to do with the surgical history. In that case, when I start to talk with them, really what we find out is there is an underlying weakness in the pelvic floor muscles. And so again, it's really quite simple. We are going to go through, me personally, I take all of my males through a minimum of an 8-week-long program. I only have them come in for 5 sessions. Now, the amount of sessions that you come in that depends so much on the therapist that you're working with. Like if you're going to go see in this area, if you're going to go see a therapist that's in network, so they're taking insurance, your sessions are going to be much shorter because that's the only way they can afford to keep their doors open because reimbursement is so low. So your sessions are really short. So they're going to want to see you more frequently. So you're probably going to go see them like once or even twice a week for that 8-week time frame. So you're looking at anywhere from like 8 to 16 appointments with them. And every time you go in, you are going to be hooked up. Hopefully they'll hook you up to a biofeedback device. So that for me and a lot of therapists, it's these 3 tiny little electrodes that are going to be then hooked up right around the rectal tissue. So it's not on the rectum, but it's right next to it. And then you're fully clothed. So you pull your clothes up over this. It's almost like a EKG for your heart, but it's for your pelvic floor. And then that connects to software and you can actually get an EMG reading of the recruitment of the pelvic floor. And so that's what we're going through in the sessions together. So the therapist and the male can see what they're doing. And we both know, okay, cool. You're actually getting a great contraction. You're not recruiting very well. You are. And then alongside with that is really making sure that, at least I hyper focus on this. You've got to be able to understand how to coordinate your breath with your core, with your pelvic floor. All 3 of those have to go in unison together to really maximize the strength, especially if we're dealing with like a stress incontinence issue. Why are people leaking urine? They're leaking urine. It's all about pressure because too much pressure is being placed on the bladder and not enough pressure from the muscle is able to resist that. So therefore the urine flows out. So if we can coordinate our diaphragm, our core and our pelvic floor together, and we create a really healthy connection with those muscles, we get great results. So I would walk them through an 8-week-long program. Every single time they come in, I'm seeing where they're at. I progress their program and I'm making it more and more difficult every single time and holding them accountable, seeing the results. I think it's extremely important because you can't see that muscle. It's not like we go to the gym and we work out our biceps, right? And you see, like my biceps are getting bigger. You have no understanding of what's happening. So I find them being able to see what they're getting, it just kind of gives that little competitive edge to these kind of boring exercises. So when they come in, they're like, I really want to get a higher reading. I really want to do better and prove that I've been doing my exercises. And that in and of itself is going to lead to a much better outcome. So that's what we're doing when males come in. There is some research to show that this is effective for premature ejaculation, but premature ejaculation is hard to measure in the research. Like, how do you measure that? Well, I mean, do you just use questionnaires, Katie, like when you're talking to them?
No, I mean, the DSM, like clearly outlines like what PE is. But usually men come in and say, I have premature ejaculation. And then you ask more questions about it. And they're like, I can only last 5 minutes. And I'm like, wow, good job. Like 5 minutes is good.
Yes.
We just have such weird notions of how long sex should last in our society and what penises should look like and how hard erections should get because of porn and because of just like locker room talk that men always feel like they're failing. So that's where the psychological piece comes in, right? Like they feel like they're failing because they can only have sex for 5 minutes when in fact 5 minutes is like pretty average. Yeah. Uh-huh.
So interesting. Okay.
Yeah. So So yeah, when I get men, they come in with claiming that they have premature ejaculation. It usually isn't premature ejaculation. And so I try to tackle the anxiety that arises because they feel like they can't please their partner, they can't hold off an ejaculation, or their erection goes down faster than they want it to go down. So it's usually anxiety.
Things.
Yeah.
Yeah, that's the thing is, like, if you look at the research, there's just not really a good way of measuring that with men. But they do have literature out there to show doing pelvic floor exercises is and can be helpful for it. It's just not measured well. So I wouldn't say it's like a robust, no good quality, robust studies are going to support that per se. But again, though, if you're having difficulty with maintaining an erection and difficulty with preventing, ejaculation quickly, it really all comes down to you don't have maybe as good of control of your body as you would like to have. And so what our pelvic floor exercise is going to do, again, we just talked about, we're going to make sure you have good coordination of your breath, of your core, of your pelvic floor, and being able to control those with breath. And so all we're doing is not only are we strengthening the muscle, but we're really helping with something called proprioception and kinesthetic awareness of the body and where we are in space. So that in and of itself, to me, makes complete sense. Of course, that would help with premature ejaculation, because now that male has more control and they feel more confident that they have control. And just knowing, like, hey, I went to pelvic floor PT and I'm getting these really high readings, and like that in and of itself is like, yeah, that can even be placebo effect at that point. Like, I've got a strong, hard pelvic floor. I can hold it. There's so much that plays into this psychologically when it comes to erectile dysfunction and premature ejaculation. Now, stress incontinence is a whole nother host. I mean, that is just truly a physiological pressure difference, and you need to have the strength there. But again, so treatable. If you're dealing with this, just go see a pelvic floor PT. And if there's stuff that's going on with the relationship, that's where, and anxiety and other things, that's where, like, Katie, why don't we talk about that right now before I get into the chronic pain stuff, so we can just kind of get both perspectives on the ED and
so surprisingly, like a lot of so the kinesthetic awareness is what I would also be focusing on, not as in-depth obviously as you, but when I get a guy in who says that his erections aren't what he wants them to be, or he's ejaculating too quickly, I usually assign homework. I tell him to go home and engage in mindfulness masturbation. So go home, turn the porn off, turn the fantasies off, pay attention to your body. So I want you to masturbate. I want you to be aware of your senses. I want you to be aware of what your body is doing, how it feels, what's happening inside of your body. Be aware of that point of no return that men talk about, where they know that if they keep going, an ejaculation is inevitable, and then bring yourself right up to that point. Play around with that point, and just be really mindful. A lot of times, what happens when men have premature ejaculation or erectile dysfunction, it means that they're too in their head during sex. Mm-hmm. So if I tell them to get out of their head and into their body, they'll realize, oh, sex or masturbation actually feels good, and focusing on that pleasure and that sensation will lead to a positive experience.
Yeah, I love that. So just really, where is the brain putting its focus? Yeah. Are we focusing up here about what's going to potentially happen in the future, of like, oh my God, I might ejaculate too soon, and what is she going to think, or he going to think, like things like that? Or you could take your focus and you could just put it down into the penis and feel all the glorious feelings that it's giving you, and just never focus on that. Interesting. I love that. So then I want to elaborate. So mindful masturbation, and then you say kind of bring them up to that point of where they're not going right past that point of no return, but they're getting close to it. How long do you advise that they kind of stay there and play? Would you give a time frame, or not necessarily?
I don't care. I don't care how long they stay there. I just want them to be aware of it. I want them to be aware of it. I want them to make friends with their body. I want them to make friends with the physical sensations of ejaculation and arousal. I think a lot of people are just so disconnected from their bodies because they're too in their heads. They're too about fantasy. They're too about porn. They're disconnected with their body. They're disconnected with their partner. And because of that, they're just all over the place when they try to have sex or when they try to masturbate. They're not present. And when people aren't present, they get anxious.
Yeah.
So the biggest way to deal with anxiety disorder is by practicing mindfulness.
Yeah. I love that perspective, because it's 100% true. You know what's so interesting is, as a healthcare provider, maybe just because we're so in this field, especially me being a physical therapist, I mean, we're in school literally every day. We're like all touching each other and like feeling different muscles, and we're doing all this. We're so in tune to our physical body, and every little abnormality you have that's not exactly considered normal in PT school, like, you're like, oh, okay, my shoulder is slightly more protracted than other people. I've got a downward rotation to my scapula. Like, we're like hyper aware of every little thing with our body. Yeah. And then you get to start working with the public, and you realize the general person is so disconnected from their physical body. And it's so interesting, because I have to always remove myself of like, okay, this is how they are seeing their body, which is very different. So you have to always keep that perspective as a health provider too, because otherwise it's hard to educate them to connect in that way again, because they're just so disconnected. Yeah. But that's great. I love that you're having them do that. And so let me ask you this, and the research, when you go through pelvic floor PT, the research has found that around, one study I have up right now is like 40% of males, and then the other one was 47% of males had great effect with erectile dysfunction. And then about like 25% had a moderate effect. So it did help with erection function. It just wasn't, maybe, again, this is subjective, like how firm of an erection are you looking for? And only, if I bring these studies up, let me look at them right now, the ones I have up. This one showed only, well, I'm not going to waste my time going through this. I was only about like 20 to 25% of men did not get results. So that can happen. And I know we talked about that last week or last episode, that if males have underlying health concerns going on, especially if there's a circulation issue going on, or if there is a nerve that was absolutely damaged from surgery, and sometimes also medication side effects, those types of things. I mean, you can have the greatest, strongest pelvic floor in the world, and you're still going to have erectile dysfunction. So there's some things that we can't help with. So that's why I think the literature shows about 75% of men are getting good results with it. And there's a 25% of males who are not. And so I'm always screening when I talk to people to figure out whether or not I think pelvic floor PT will or will not help them. So what are you finding when you walk males through this? How long are you working with men? I know it's always different. And then what type of results are you seeing that they're getting with this type of treatment?
I mean, I think it depends on two things. The first thing is how bad their anxiety is. So usually if they're experiencing anxiety about sex, they're experiencing anxiety about everything.
Yes.
And they may not even know it, because again, that disconnection, we're not only disconnected with our bodies, but we're disconnected with our emotional state as well. Sometimes people run on this heightened anxiety level for so long that they begin to think it's normal, and they don't know anything else. Yeah. So how bad their anxiety is. And the second factor is if they're going to do what I tell them to do. So I'm sure you get that too. If they come in and they're like, please help me. And I'm like, I'll help you, but you have to do what I tell you to do. So if they're really motivated and if they do what I tell them to do, they'll be fine. Like, and if it's psychological and not physiological. Right.
Well, and I think there's both. I really, truly 100% don't think you can separate the two. Yeah. There's always going to be a psychological component to erectile dysfunction and because even if there is a physical issue, then it's going to then turn into a psychological concern. And if it's psychological, I think that can lead to a physical concern. So they're so intertwined with each other.
Yeah, for sure. I mean, I think I may have said this already, but I get a ton of guys in their 20s that come in and say they have ED, and I'm like, there's no way you have ED. They're perfectly healthy. There's nothing wrong with them physically.
Yeah.
And those are the cases where I'm like, okay, this is really like 100% anxiety or 100% psychological. They're completely in their heads about everything in their life. And in those cases, I mean, it's a fairly quick quick. I mean, again, how bad their anxiety is and how much they'll actually listen to me.
Right.
If we can get their anxiety level lowered, and if they're doing everything I tell them to do, you know, the problems usually clear up fairly quickly.
Yeah, that's what I would assume. You really can't give a good estimate from that standpoint, because here's what I will for sure say as a healthcare provider is, when we're dealing with anxiety and more of a thought process that is leading to dysfunction in the body, such as erectile dysfunction, it really is a matter of how quickly are you going to incorporate and apply what you learn from your therapist. Like when you give them that advice of like, hey, let's try this and that, if they're able to really take that in, they believe in it and they apply it, then we can see tremendous turnaround, things like that. But there's also a lot of barriers sometimes to people actually trusting and believing what you even say, and then also applying it. So there's both. You have to have both of those aspects to it. Where else, I'll say from like the physical standpoint, for sure, you're not going to see a good result for a minimum of 8 weeks. Like it's very clear cut. You can see results. You can start to see results within 4 weeks, but you're not going to get really good results until 8 weeks, and then 12 weeks, depending on the patient. We'll for sure see wonderful results. So there is for sure, there is a timeline when it comes to physiologically having what we call true hypertrophy or building of that muscle. That takes a certain amount of effort. Here's what's something interesting. I never have an issue with compliance with my males doing their exercises in this setting, because I am fee for service. If males are coming here and they're paying the money for the treatment, in fact, my males are so compliant. They're more compliant than my females are. It's incredible. Males are also, more often than not, this is not a black and white, but I do find my male patients are much more logically driven and very goal oriented and just structured. They're much more structured. And so if I say, hey, we're going to do this, this, and that, they're like, okay, we're going to do da, 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 da. So I see really good, promising results when we're dealing with this, because I don't have to deal with a belief system. I don't have to deal with really, let's look at the thoughts that are running through the mind and having to apply that. It's just simply like, let's squeeze the pelvic floor muscle and relax. It's much more of a simple treatment than what you're dealing with, really. Okay. So there's that. Is there any other things that you want to talk about as far as erectile dysfunction and premature ejaculation?
I mean, the only other thing that I screen out for, sometimes men experience PE or ED, and it's partner specific. Mm-hmm. So, you know, for example, if a man comes in and says I have PE, and then I start asking questions, and it turns out that he's with a woman who requires him to have sex quickly because she starts hurting after 5 minutes.
Which then is a lot of my patients, because the women are like, you better hurry up because it hurts them so much. Okay, interesting. I'm going to hear it from the male's perspective now.
So then he says things like, maybe his last relationship was like that, and now this relationship that he's currently in, she wants it to last a little bit longer. Now he's in his head about it. He's feeling anxious about it. He was trained by his last partner to go very quickly. So now that's what his penis and his brain know. So sometimes a lot of like partner specific issues can come up. And if that's the case, then I need to see both people in the relationship so I can get people on the same page and they can tackle whatever issue is presenting together. Right.
That makes complete sense, especially like you said, if they're in their head, but then their partner is saying like, will you just hurry up? Or I can't believe you better not come right now. And they say things like that to them, then
the worst.
That's gonna
or if she gets angry, again, we're talking about heterosexual couples, but obviously it goes both ways. If she gets angry because he loses his erection, that prompts a whole cycle of erectile dysfunction when maybe it was a one-time incident. So penises are very finicky.
Yeah, no, they are. You're right. Like there's a lot of different factors. So it's almost kind of sad, because as women, we maybe expect too much from males as far as what their penis needs to do, what it needs to look like, how long the erection should last. And we put really, we in society put an unnecessary pressure on males.
Yes.
So that kind of compounds the factor. So you get both partners in there and you talk about these things.
Yeah, it's a lot of psychoeducation, just re-educating people about what is normal, what isn't normal, how to deal with anxiety, how to deal with communication around sex. But yeah, I feel very badly for penises in our society, because they get the brunt of a lot of the stereotypical ideas of how they should look, how they should act, what they should do. Whereas, you know, women can hide a lot of those things and men can't.
Right. No, they can't at all, because whether it works or it doesn't work, there's really no, it's very, very different. Okay. So thanks for elaborating on this. I love these podcast episodes because I learn from you as well. So the other thing that I didn't cover is more of a chronic pain concern when men are coming to me because they're having chronic pain, which is absolutely affecting their sexual life. Are you treating that often, Katie, where people come to you with pain? Or not?
I refer them to you.
Okay. You know, you do, but I need to start cross-referring when I'm noticing that there's a lot of relationship dynamic concerns. A lot of times males that I work with this, they aren't even in a relationship. Like it affects them so much that they are afraid to even engage in a relationship because of it. Because how do you explain that? And this happens with my females. Like when you have pain with intercourse, it is so hard to start a new relationship. And then how do you say, hey, I can't have sex because it hurts me? Like I literally have physical pain when I go to have intercourse. And a lot of people don't believe them. That's another thing that's horrible about it, is people don't believe you when you say that, because that's not something that we talk about. It doesn't seem so common, even though it's way more common than people recognize. So one of the biggest things that I see a lot of times it will present as testicle pain, and very often in our medical society, it gets blamed on prostatitis or epididymitis is another thing, your epididymis in the testicles. So most males will go to the urologist first. Maybe they'll go to their primary care, then the primary care will send them to the urologist. The urologist will, half the time, this nowadays, do a very simple exam, maybe not even do a physical exam on the males. Like very rarely are they actually even being touched and palpated to see what's going on with their tissues, which is super sad, I think, because that puts a lot of pressure on me as well, because I have males coming into me who've gone to their healthcare providers and not really been, in my opinion, properly assessed. And so now I'm like, I feel like sometimes this pressure on myself to let me actually see what's going on. And do I need to refer you back to them and say, hey, no, listen, this is something that was missed. But because of that, it's always treated with antibiotics. Men who have pain with intercourse are always given multiple rounds of antibiotics. And I have some urologists that are phenomenal and understand that when antibiotics don't treat it, they'll call it like a fake or I always say this word wrong, a pseudo prostatitis or pseudo epididymitis. And then they'll refer them to pelvic floor PT. Really good urologists will do that. But I will tell you, it's very far and few between where I see urologists have that level of clinical understanding to do that for their male clients or patients. So then they come to me, and at this point, most of the time when I get males who have this, it's been years. Typically, they've been dealing with this, and they've been on multiple rounds of antibiotics. Some of them have had, had their prostate removed. Some of them have had hemorrhoidectomies. They'll, for whatever reason, I don't know why, they like to go remove hemorrhoids, thinking that's going to solve the problem. Strangest thing in the world to me. That doesn't ever solve the problem. It normally makes things worse, because now we had a hypersensitive nervous system and we just went in and did surgery on it. That's just going to make the nervous system more sensitive. So when this is all happening, it is because, again, the nervous system is very hypersensitive. And there's two different ways this kind of happen. There's something called like central sensitization, and there's something called peripheral sensitization. So if it's the central sensitization, that's the brain and the spinal cord nervous system is very upregulated. And for those males, I'm not going to see just pelvic floor pain. They're going to have a like global pain throughout their body. Maybe the whole right side, they're going to have pain going down the leg, like a sciatic pain. And they don't even know it's all connected. They're like, yeah, I have sciatica. I've got low back pain. I've got this right testicle discomfort, and my right shoulder bothers me. So that is more of the central nervous system is hypersensitive. Peripheral sensitization is where we see it more in just like one local spot. So if it's just the testicle, just the rectum, tip of the penis, shaft of the penis area, my clinical way I look at it, that's more of a peripheral sensitization. So the peripheral nerves are now hypersensitive, which is way easier to treat, by the way. As things get way more chronic in nature, things are going to they're going to go from a peripheral sensitization to a central sensitization. And that's because as pain starts to spread in the body, no matter where it starts, when I've got pain, let me give an example. If I've got pain in the testicles, and I'm hyper focused on it, of course, because I'm like, oh my God, what's wrong down there? And especially my genital region, which is such a scary area to have pain. Our medical system doesn't treat sexual dysfunction well at all. They don't know what to do. So you've gone to all these doctors and they haven't helped you. So now you're really freaked out about it. So the more my brain focuses on that, what's happening actually is the brain is now sending a message down the spinal cord to those peripheral nerves. And it says, hey, nerves, I want more information. And so now those peripheral nerves are sending up more information. And then the brain goes to the neighboring nerves, I call it. And it says, hey, what's going on nearby? So like, what's going on the inside of my thighs? What's going on at the rectum? What's going on above the penis, the kind of lower belly tissues? And so now the brain's sending a message down to those nerves and saying, hey, can you send me more information as well? And now we get this spreading of pain. And that's why chronic pain typically spreads. It's just the nervous system's way of trying to figure out what's wrong. But that's awful. Nobody wants that to happen, right? So that's the number one thing is happening is the nervous system is in that state. Now, secondarily, when the nervous system's like that, the muscles nearby are going to guard, just like anywhere in the body. So if I sprain my ankle, I'm not going to just go, walk on my ankle. I'm going to kind of guard my ankle. I'm going to walk kind of slow. I maybe like walk on my tiptoes. If I hurt my shoulder, people who hurt their shoulder, what do? They kind of draw it in close to their body. I might wear a sling. And so that's the body's way of protecting. So I guard those muscles. So now we've got a hypersensitive nervous system. Now we've got muscles that are like way overregulated. And again, anxiety also, men who have suffered from anxiety, they can also, that in and of itself can make the muscles super, super tense and the nervous system tense in the pelvic floor area. And I don't know, Katie, did I talk about this in past episodes? Did I give the dog example? How dogs are with their tails?
No.
Okay, so this is a great example. So if you ever look at a dog and they are scared, there's a lightning storm, there's fireworks, or the owner's yelling at them. If you look at a dog's posturing of their body, what do?
They're hunching up.
They hunch, and then what do they do with their tail?
Stick it into their legs.
They tuck it. Yeah, they tuck their tail. So our pelvic floor muscles are all attached to the tailbone, and their job is to tuck the tail. We don't have a tail, we have the tailbone. Yeah. So and there's research to prove this. When we are in a stress response or an anxious response as humans, we don't even know we're doing it, but we're engaging the pelvic floor muscles and we're tucking our tail. It's just a biological response. Humans also, when we're in our kind of scared, sad posturing, what do? We crouch forward. And we know from the research, just being in this crouch forward position for a small time frame can lower testosterone levels, it can increase cortisol and adrenaline levels. So now we're affecting, just by my posturing, the hormones that are in my body being released to the bloodstream. We know if we're in a nice big open posture, that actually can enhance testosterone levels just by being in a posture like this for 5 minutes. So all of these are playing together. You see, it's like a downward spiraling effect. So I've got anxiety, I've got this upregulation of my pelvic floor muscles. I'm not really aware of it. My nerves are really hypersensitive. Now we're going to get a blood flow concern. So if I've got really tight muscles, I'm also not going to get a lot of good, healthy blood flow to those tissues. Well, that's also going to make the tissue really angry and the nerves even more mad. I'm worried about it. And because I'm worried about it, we know that there's something that happens called neurogenic inflammation. And so now my brain is going to send down an inflammatory response to that area because it's worried that there's something wrong. Well, the more inflammation I have and the more inflammatory molecules like histamines and cytokines, the more the nervous system is like, oh my God, and it gets more sensitive. The nervous system gets more sensitive when it's got these cortisol, adrenaline, and these inflammatory molecules sitting around it. So we get this like horrible perpetuating downward spiral of why we get this awful chronic pain. And the medical system throwing antibiotics at it and not knowing what to do about it and making men feel like it's almost in their head, that does not help the situation. So we have this kind of perfect storm for why chronic pain stays in this area. So what we do for treatment is very similar to what I talked about with the females. Is we are doing, I do a ton of education about the nervous system. I need them to understand how their nervous system is working against them. So that way we can be aware, we can detach from these bad systems that are in place. And then we're going to reprogram the nervous system, which we have unbelievable control over. We do a lot of tissue work. So I'm doing a lot of relaxing of that pelvic floor muscle, stretching the muscle back out so it's in a more happy state. So it's not in a super short state. We're desensitizing the nervous system by doing this tissue work, a moderate amount of pressure to where it's not painful, but it doesn't just feel like pressure. That's how we can get the nervous system to adapt and change and calm. So lots of massage, myofascial type work, stretch program. And then I'm also getting them exercising. A lot of times when they have pain like this, males will find that exercise makes it worse, which it can. And intercourse makes it worse because of the amount of stress that you're putting on the tissues. Yeah. So we pace back into all of those things. It's called graded exposure. We just slowly start to expose the body to all of these different inputs, pressure, movement, so forth, so they can start to tolerate more and more and more. So then I'm pacing them through. Now these programs, I'm going to be working with men for an 8-week time frame. But I will tell you, my males, what's so sad about my males is by the time they come to see me, they have been dealing with this for so long, years, that it takes me a very long time to get them to a level that they're happy with. Yeah. So I've had some males, I had one male I treated, he had pain for over 5 years. And within 6 weeks, he was completely pain-free, which that is like unheard of. He was unbelievably compliant with everything we did. But that was unheard of. I couldn't believe how quickly his nervous system turned around, and it was life-changing and amazing. And I still follow up with him and he's doing phenomenal. But I have a male patient right now I'm treating, and he's doing so good. But I've been working with him for probably 6 months now. And the reason why it's taking a while is because he wants to get back to scuba diving and going he loves to just really be active. And so that's great if you want to be there. But I have to take you from this really deconditioned, painful state back to just baseline, being able to tolerate everyday life, then rehabbing to these higher level activities. So that can take longer. So for males that are dealing with this, the time of treatment really depends on where you are, like how deconditioned your body is and where do you want to be. And that's going to determine the length of your program with your pelvic floor therapist.
Interesting.
Yeah.
Cool.
So that's kind of treatment.
Yeah.
What we're going to be going through with them.
Yeah. That's awesome. Well, good. And remember, if you're listening and you have additional questions about anything that Molly and I talked about, feel free to send us an email, call us, visit our websites. And we are happy to get back to you.
Yeah. And if you are just trying to figure out where's a pelvic floor PT, where's a sex therapist near you that you could access, we can also help with that. I help people all the time find therapists. So lots of options out there. Don't feel like you're stuck. Don't feel like you have to continue to live with this. There's so many beautiful conservative treatments that can be done for these types of concerns that males are suffering with in silence really right now.
Yeah. All right. Well, thank you so much for listening. And we don't necessarily have a topic picked up for our next podcast, but as usual, if you have special requests for topics, please send them in to us. You can email either Molly or me. And we will dedicate a whole podcast to talking about topics that are sent in.
Yeah, that would be so great. If you do have anything that our listeners are listening right now, they're like, I wonder about this or that, please send it in so that way we can try to address that for the public. That's the goal of this, is just to really help educate everyone on healthy sexual intimacy aspects of our human body.
Mm-hmm. All right.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, You can find us at pelvicbalancept.com and at drkatieschubert.com.